Today we will talking about the general anesthesia and sedation. Both reduce the level of consciousness, that is perception to various stimuli. And general anesthesia reduce consciousness into deeper level and cannot perceive much more stimuli than in sedation. So the difference is matter of depth. The borderline between general anesthesia and sedation is generally the use of muscle relaxant, number one, and number two, the use of endotracheal tube. Or someone said even the sedation is the general effect, so that is also general anesthesia. Anyway, sometimes even sedation makes trouble, dyspnea. If neglected, that threatens the life. Most common mechanism of most common mechanism of dyspnea in the sedation is tongue sagging. It is a tongue muscle. The airway is from nostril and the pharynx, larynx, and the trachea. In this area, the bifurcation between the esophagus, which is a food passage, and the air passage, and there is a bifurcation here. So there is a very narrow airway here. When people lose consciousness, this muscle, the tongue muscle, can be sag and obstruct the airway. So at that time we can lift the chin a little bit upward, then the airway can be opened. But in a severe case, we can insert this kind of endotracheal tube from nose to mouth, from nose or from mouth, like this. This is trachea and the vocal cord. Actually, when used this kind of device, this end of tracheal tube irritate the vocal cord and inner surface of trachea. So these days you can also use this kind of mask into larynx. It is placed in the bifurcation of trachea and esophagus, larynx, so it can sealing the airway without irritating the vocal cord and inner surface of trachea. Both tube and larynx masks can be used sometimes, not always, especially in deeper sedation. But it is not harmful, but a very important safe device. We in JJ Plastic Surgery, 2 board-certified anesthesiologists serves together, and all the procedures are under supervision of Vitality under specialists. Thank you.